Gang, welcome to another edition of Ahysen Nation. So glad you joined us. Whatever platform you are watching us on, make sure you do a like, make sure you do a subscribe, share. We want to make sure we get a number of ways to get in touch with you on our social platforms. Today's show is going to be a fantastic show. We're going to be talking about some anxiety issues as it relates to Louisiana and as it relates to COVID, and the study that has been done recently on before, during, and during the pandemic. And I'm going to go ahead and bring our guest in. I have a very special guest today, and this is Nick DINZANT, and Nick is with Quote Wizard. And you guys, first of all, welcome. Thank you for doing this for me. I appreciate this today.
Thank you for having me. It's an important story.
Yes, it is. First of all, my background, just, in 10 seconds, is I am an anxiety-ridden person. I've dealt with anxiety issues since I was 14, been formally diagnosed with an anxiety disorder at 14, medicated in and out of therapy, in therapy for the last 3 or 4 years, weekly, then every other week. So you don't take a guy with my anxiety disorder and drop him in the middle of a pandemic. That's just not funny. And I told my doctor that. But then I came across some of the studying that you guys have done, and the number of people that were dealing with anxiety and depression in Louisiana, second highest in the country during the pandemic. And I just wanted to bring you in and kind of get you to talk a little bit about your findings, talk about the ethnicity, if there's any kind of breakdown there, the demographics of the anxiety/depression, and kind of give us a little background on your organization and the findings that you guys found. So I'm going to go ahead and let you take the floor.
So this study is one that we've been doing ever since the pandemic really started. And what we have basically found is that right when the pandemic started, we found that people's levels of anxiety and depression, the number of people experiencing anxiety or depression, that started to go up very quickly. Now, it really peaked around November of December of 2020. And ever since then, it has been declining. When we look at a nationwide statistic, we find that anxiety and depression has decreased by about 25% nationwide since the beginning of the year, since January 2021. Now, what we found when we looked at Louisiana specifically is that anxiety and depression levels, the number of people experiencing anxiety and depression, that has not decreased in the same way that it has decreased in other parts of the country. And that's why right now we're looking at Louisiana, which has the second highest rate of people experiencing anxiety and depression. To give you some very specific numbers of that, when we looked at depression specifically, the beginning of the year, 31% of people in Louisiana were dealing with depression. That number has decreased to 29%. Anxiety from 41% to 36%. And when we look at both of those combined, we say anxiety and depression decreased from about 45% of people who are dealing with one or the other or both down to about 39%. So the number of people who are reporting dealing with symptoms of anxiety and depression is declining in Louisiana, but it's not declining as quickly as other parts of the nation.
Do you guys have any idea why that is the case, specifically with Louisiana?
So when we looked at it, we looked at a number of different factors, and COVID obviously is the primary one, but it's not just COVID itself. What we have found is that the coronavirus pandemic really acted as an accelerator for anything else that was going on in society. If a state was struggling with unemployment, if a state was struggling with internal factors, even things like the weather, was there flooding? Were you dealing with fires, natural disasters, et cetera, et cetera? All of those things kind of played into it. And what we really found is that those factors played a big role in adding to the amount of anxiety and depression that we were seeing. And Louisiana dealt with that, high unemployment rates. There was a lack of access to medical care, to mental health services. Because something that we found is when there was a high unemployment rate, people also lost their health insurance. And that meant that they lost access to medical care in a lot of cases too. And I think that one thing that's really important to talk about when we talk about this is that we're seeing very high numbers of people dealing with mental health issues. And there shouldn't be a stigma attached to that. This is not a problem that just a couple of people are facing. There should be no shame, no stigma attached to people who are saying, like, I'm not okay right now. That is understandable. And there should be more mental health services that are available to people, and any kind of a stigma that is attached to people who are dealing with symptoms of anxiety and depression, that should be gone.
You're right on about the floods. We've had floods. We're on the Gulf Coast. What city are you in? I'm not remembering.
So I'm based out of Seattle.
So
yeah,
you're on a water, you're kind of near the water as well. But we have more storms down here in the Gulf, and we've had an unusually active hurricane season last year and this year. So there was already a level of that pre-pandemic, and now with the pandemic. Are you seeing anxiety and depression levels differing among women versus men?
So that was pretty much the same. Women had a little bit of a higher rate, but not very much. And then when we looked at it across other demographic lines, when we looked at people of color, we found that was pretty consistent too, right? White communities had about the same level as black communities, as Hispanic communities. Where we really found a big difference is when we looked at ages. So when we looked at people who are, say, 18 to 29 versus 70 to 79, what we really found is that younger communities had a much higher level of anxiety and depression-like symptoms than did older communities. Now, you could say that some of that would be that, well, younger communities might be a little bit more willing to talk about it and to come out and say that they have a problem, that they have a mental health issue that they need help in dealing with. But what we found also is that, let's say you look at the statistics for, say, 18 versus 29 versus 70 versus 79. What we really found is that in older populations, anxiety and depression levels decreased by as much as 40% since the beginning of the year. In younger populations, that hasn't happened. You're looking at only a 13% decrease. So I think that what we're finding is that younger people are having a much harder time dealing with the pandemic than our older populations.
Younger people?
Yeah.
Is that surprising to you as a researcher?
It is, until you kind of jump into it a little bit more. And then I think that what we're finding is not only is the pandemic a new experience for younger people, but it's also hitting a lot of younger people right as they're kind of making that transition into the rest of their life. They're starting out work, and maybe they're at the lower level, they're the entry level position, and now they don't have a job. They're starting out work and they're used to going to a place, but now they don't have a mentor, someone to kind of guide them through this transition from college and into the rest of their life. And they're more socially isolated. Yeah, I'm in my 30s. I have a family here at home, and it's easier for me to handle the pandemic. But I have friends who are 20 to 25, and they're just by themselves. And I think when you look at that, of just transitioning into the world, and suddenly it's a very uncertain place, and you don't have anybody to guide you through this, it kind of makes sense.
That's amazing. I would not have thought that about the younger demographic having more problems with anxiety, because usually they are so easily to adapt to things, and people, the older guys like me, are the ones that have the anxiety issues. How do you differentiate, or can you differentiate, between anxiety issues and depression?
So I can differentiate more based along the numbers. That would be more to a mental health professional that could answer that question a little bit better. But we definitely found much higher levels of anxiety. So when we looked at Louisiana specifically, we saw at the peak was around 47% of people that were dealing with anxiety. And I think that, the reason for that is it's increased stress, right? It's not moving into that other territory where you really feel every single day that things aren't getting better. So when we look at anxiety levels, we saw those at around 46%. When we look at depression, we saw that at around 31%.
Very interesting. Is there a state or states that are doing better with the issues of anxiety and depression than other states? I know on the report that I'm reading that you had sent, and all the facts and figures, it looks like Louisiana had the second highest rate in the country of the anxiety and depression issues that are mostly related to the COVID issues, but like the other issues, like you mentioned, the flooding. Any states doing really well?
When we look at some of them, they're mainly in the upper Midwest, South Dakota, North Dakota. They're both at around 26% of people that are experiencing symptoms of depression and anxiety. Other states that kind of fit that mold: Wisconsin, Iowa, Nebraska, Illinois. Those are some states that are, I guess, handling it better, for lack of a better word. I don't mean that it should be a thing that it's not a competition, but I would say that they are reporting lower levels of it. And the big reason for that is not that their highs weren't the same as Louisiana. They were a little bit lower, but not significantly. It's that the decrease in those states has been much more substantial. For example, we look at a state like Connecticut. Well, they're at 26% right now of people experiencing anxiety and depression, but they had a 34% decrease over the last year. And you compare that to Louisiana, which had roughly a 15% decrease.
That's interesting. Now, with the pandemic, in April and even in May of 2021, this year, we were seeing here in Louisiana the cases just starting to plummet. And then over the summer, we had this variant, and then you had the reluctance of vaccinations here in the South Louisiana, and now the caseloads have gone back up, and in some areas of Louisiana, even higher than in some of the peak time in 2020. Are you able to measure if anxiety levels are going back up after they had seen a dip initially?
So, no, but yes at the same time. So we don't have the official numbers that have come in, because this ended essentially in August, where we were able to look at it. And the data in terms of anxiety and depression is lagging just a little bit behind where we saw that big pickup in coronavirus cases. But if you look at, say, in 2020, and what we found is that anxiety levels were about here as we went into the pandemic, and they went pretty steadily up as we went into summer and then early spring. When we started to see the number of cases go up again, then we started to see them go. So if I could kind of crystallize that a little bit, they were here as the pandemic picked up, they started to go this way. As we got into summer and things started to kind of slow down a little bit, businesses started to open back up, we saw the levels start to go down again. Then as we got back into November and December, you're dealing with the holiday season, you're dealing with another increase, and they went back up. Now, they have been going down ever since January 2021, but I would say, looking at the data, that as the cases start to pick up, they're going to pick, anxiety and depression is going to pick back up again. I would anticipate that to happen. And what's different, I think, this time around too, is that now we do have the vaccine. And without kind of getting into that entire discussion, whatever side you're on about it, you might be really mad at the other side and really frustrated with the other side. And I do think that that is going to play out in people's levels of anxiety and depression.
Well, it's certainly an issue that's not going to go away. I mean, COVID is here to stay. Yeah. We've pretty much determined that, but we do have, in my opinion, scientific evidence of a legitimate way to get this thing under control, and yet so many people are still very, very either anxious about the vaccine or from political reasons leaning, like you said, to one side or another. And then coming into the holidays, which is already a period that we know from historical data without a pandemic is a time when we always have increased issues, with anxiety issues around the holidays. Where do you see this going, and when do you see it kind of leveling off to maybe the old normal or the new normal?
I don't know.
I'm asking you to predict the future, really, kind of, and you can't.
Yeah, and that not anytime soon.
Yeah.
Because not only are we seeing coronavirus cases start to rise, we're seeing there's still continued issues with unemployment. We're having unemployment benefits that are going to end. Eviction moratoriums could be potentially ending. Now we're talking about the idea of getting children vaccinated. So I think that not anytime soon.
How do you guys conduct your research, and when are you going to conduct? Is it daily, monthly, every quarter? Like, when do we see another study that we can compare to the study that you sent me this past week?
So we would probably update it again towards mid-fall. I guess we're in fall as of right now, but we would probably around the holidays is when we would go ahead and do it. And the way that we've been conducting most of the research, which we've been doing essentially ever since the pandemic began, is there is a fantastic survey that is done by both the CDC and the United States Census Bureau. It's the Pulse Household Survey. And what that allows us to kind of do is to go into what is essentially a mountain of data and be able to search through all of that to get a really accurate picture of essentially how communities are doing based on everything from anxiety and depression. What are their possibilities of eviction? What are their reasons for not getting vaccinated? You can go into all of that data if you're able to sort through literally millions upon millions of pieces of information and kind of understand how to get the key part out of it, I would say.
Are there any things that you watch as indicators, precursors to trends?
Mostly the coronavirus cases.
Mm-hmm.
When we see the cases go up, we see everything else change too, because it has such a big effect on that as well. Because not only when the cases start to go up do we see anxiety and depression levels historically have started to go up, but we also then see the other repercussions of the pandemic, in which we're now looking at situations in which, well, is there going to be lockdowns again? Are we going to be having mask mandates again? Are there vaccines going to be mandated to get into this place or to get into this place? And when you see all of that kind of combined, it essentially all feeds off of each other.
I follow you. Anything else before we close out our visit? You've given me a wealth of information. It's been fantastic.
No, I think we pretty much covered all of it.
I know Louisiana and Oklahoma have the highest rates according to your study. Are you seeing Oklahoma coming down?
No, not really, not substantially. Just about the same. Yeah, statistically significant, but then when we're looking at that stuff, we're talking about 1.56 percentage points and things like that. So not significantly different than Louisiana. When we look at states that pretty much stayed the same over the pandemic or had a very relatively, compared to other states, smaller decrease, Tennessee, Oklahoma, and Louisiana.
Wow. Nick DINZANT, thank you so much for your time today. The organization is called Quote Wizard. Is there any public website or Facebook page or any kind of way that you want to publicize on getting your word out more? And where people can
Yeah.
tune in?
So our website is just www.quotewizard.com. What we are is we are specifically, basically, you can think of us as like the Expedia of insurance, in which you can go to the website and you can get quotes from a variety of different places. And the reason that we do studies like this is we're always looking at anything that could potentially affect people's insurance rates. And COVID and health is obviously something that could potentially affect insurance.
I'm afraid that story's still being written.
Yeah, that would be my answer to that one. I think you're going to see some changes moving forward.
Nick.
There's a lot of talk right now that COVID might potentially no longer be, you may not essentially be receiving free care for it. But that's a little bit at this time something that needs to be watched, but that might be a little bit of the cart before the horse.
Yeah, it's probably a little too early to tell because I know the flu shots are
Yeah.
covered by a lot of insurance companies, and then some are not, but most are. So I think that story with COVID is still yet to be seen as well with insurance companies. But right now here in Louisiana, it's free for the asking, and we just need to get more and more shots in arms over here, at least our situation. Thank you again for your time, and we may be able to hop back on with you later in the fall, closer to the holidays, and see if you've got some new numbers for us.
Happy to be on. Thank you.